Good day. The topic for today will be the tooth anatomical landmarks. So, the landmarks are divided into two, into elevated, okay, wait, elevated, and depressed landmarks. For your elevated, first you have your dental lobe. Dental lobe is one of the primary centers of growth and calcification present during the crown development, which for examples are your mamelon, cingulum, and cusps that matures or are mature forms of lobes in the anterior and posterior teeth respectively. So the mamelons are the one with wavy ridge appearance during eruption. So it is any one of the three primary rounded projections in the incisal ridge of a newly erupted incisors teeth. Secondly is your cingulum. Okay, wait. Cingulum. Cingulum is a rounded projection making the lingual bulk at the cervical third of the crown in the anterior teeth. Next is your cusps. For your cusps, it is a divisional primary pyramidal elevation on the third of the posterior teeth and the incisal third of the occlusal part of your tooth. So usually here are your cusps. Okay, for your molars also you have your cusps. These are your cusps. Next is tubercle. So for your tubercle, it is a small elevation produced by excessive formation of your enamel. Also, it can be noticed at the palatal surface of your upper first molar, sometimes at the lingual surface of incisors over your cingulum. So for this case, wala tayo tubercle, but this one is tubercle. So note that tubercle differs from a cusp because it is formed of enamel only, while cusps is formed by pulp horn covered by dentine and enamel. So the tubercle is just plain enamel, and the cusp is composed or covered by dentine and enamel. So next one is your ridge. So ridge is a linear elevation on the crown defined according to its shape or location. So let's check on the occlusal surface of your mandibular premolar. Let's go to figure A, the proximal or marginal ridge. It is a mesial and distal elevated margins in the lingual and occlusal surfaces of the both anterior and posterior teeth respectively. So I have this, an elevated mesial surface and elevated distal surface. We call it the proximal ridge or the marginal ridge. Moving forward to your anteriors, you have your mesial ridge and distal marginal ridge. For the ridges found in the labial surface, we call it the labial ridge. So it is a pronounced, it is a pronounced labial development of the middle lobe of the anterior teeth. So if this canine has its cusp tip, sorry. This area is your labial ridge. So see that elevated area, a pronounced labial development. For the buccal ridge naman, if you have labial ridge on your premolars, we have buccal ridge to your posterior teeth, more specifically, or exclusively to your premolars and posteriors. You have your buccal ridge, which are defined as a linear vertical pronounced buccal development of the distal or the middle lobe of your premolars. Again, followed by your lingual ridge. Okay. This is the lingual part of your maxillary canine. You have your lingual ridge. With this ridge, we are forming fossae or fossa. The lingual ridge usually extends vertically from your cingulum to the cusp tip of your canine. This is your cusp tip. Thus, dividing its lingual fossa into mesial or distal. You have your incisal edge or incisal ridge first. Okay, so I have to draw first the fossa. So this area, take a note of this area. This is your incisal ridge. It is a lingual projection at the incisal margin. Incisal margin, remember? This is the cervical. This is the crown. This is the incisal area of the newly erupted incisors. The ridge is transformed into edge by an attrition. So, during fresh eruption or early eruption, it is a ridge. But due to function, it wears off. It becomes to an edge. The cervical ridge. So we can see this on your premolars or canines. This one is not that prominent. We have to look for another one. Yeah, this one. This area is a diffuse mesiodistal excessive formation of enamel at the cervical third of the crown called the cervical ridge. Remember, this is the cervical line, the CEJ or cervical area, where you can find this excessive formation of enamel making a bulk or bulge called the cervical ridge. How about the cusp ridge? This area are your cusp ridge. As you can see, it is a elevated area, a ridge-like formation that is buccal and lingual elevated margins of the occlusal surface of your posterior teeth. It descends mesially or distally from the cusp tip either into the proximal or marginal ridge or to the buccal or lingual of the developmental groove. According to shape, you have your triangular or occlusal ridge that descends from the cusp tip of the posterior teeth towards the central part of the occlusal surface. Okay, it is formed as the occlusal sides of the cusp ridge meets together to form a line angle. So another one from here. Remember, the starting area is the cusp tip moving laterally to the cusp ridge. on the occlusal surface. Next one will be your triangular ridge for your molars. So let's see for your mandibular molars if you have triangular ridge. Yes, we do have here. Wait a second. Yeah. For your molars, you have your triangular ridge, cusp tip, and the marginal ridge are here. Can be found in your margins. Okay. As you can see, you have your inclined cuspal plane. Because this is a ridge, you have this inclination. These areas are inclination, or more appropriately coined as or termed as inclined cuspal plane. When a ridge forms together, it forms also a plane. Next one will be a transverse ridge that can be found in your lower premolars, or can be found in any posterior tooth, but more prominent. As you can see, from a cusp tip to another cusp tip, we have this transversing elevated portion called the transverse ridge. By definition, this is the union of directly opposing buccal and triangular and lingual triangular ridge buccolingually crossing the occlusal surface of the posterior teeth. Again, we have this buccal triangular ridge, and we have this lingual triangular ridge crossing the occlusal plane. So we coined it, or we termed it as your transverse ridge. Next one is the oblique ridge, which is prominent in your maxillary molars. You can see that this is your mesio-buccal cusp, mesial. This is the buccal lingual. So mesio-buccal, disto-buccal, distolingual cusp, and you have your mesiolingual cusp. From your distobuccal cusp, there is this ridge running from there to your mesiolingual cusp, making a transversing ridge. So we call it an oblique ridge. I'm sorry, an obliquing ridge. So this is the union of non-opposing. If the transverse is opposing, the oblique ridge is the non-opposing buccal and lingual triangular ridges obliquely crossing the occlusal surface of the maxillary molars from the mesiolingual cusp to your distobuccal cusp. Next is the depressed landmarks, which are fissures, grooves, or just depressed areas found in your tooth or teeth. First one will be your developmental groove. Developmental groove is a deep linear depression in the occlusal surface. And may extend buccally, lingually, or mesially. It denotes the line of fusion of your primary lobes. Like for example, you have your buccal developmental groove, the lingual developmental groove that may extend further buccally or further lingually. Just remember that it denotes the line of fusion in between two primary lobes. So I can make it more defined. It is also very important in doing your cavity preparations. So These are your developmental grooves. So for those patients, you can see this area, yung may mga black, that denotes that there is activity or caries activity going on there. For your supplemental grooves, this naman are grooves which are shallow linear depression in the occlusal surface, which does not demarcate the line of lobe fusion but represents a branch from the developmental groove. If this is your developmental groove, you have accessory or excess groove formations which are called supplemental grooves. How about fissure? A fissure is a deep cleft or defect on the occlusal or buccal surfaces resulting from the linear imperfect fusion of the enamel of the dental lobes found in the place of developmental grooves. So a fissure is somehow looks like this by definition. Can be found here or in premolars with Y configuration, found as a clefting area in your occlusal surface. How about fossa? Wait a second. Okay. A fossa is a small depression or concavity on the occlusal surfaces of posterior teeth and lingual surface of your anterior teeth. It has different shapes including a triangular fossae or fossa. You have a triangular fossa here. You have also triangular fossa here. So it is present between the branches of the central developmental groove when they terminate before the proximal marginal ridges in molars and premolars. So true enough that developmental groove is here. Before they terminate, you have your triangular fossa. I'm sorry, but for this one, I think I made a mistake there. This is my triangular fossa here for your distal surface. Next is your circular or central fossa, which can be more distinguished in your mandibular second molar. So, circular or central fossa is present at the bisection of the developmental grooves on the occlusal surface of your molars. So, I put a line so you can actually see. Here is your central fossa. For the anteriors, you have your lingual fossa, as we mentioned. So, usually, a lingual fossa follows a triangular outline here, bounded by your incisal ridge and the distal marginal ridge or the mesial marginal ridge. Superiorly, it is bordered by your cingulum. How about the pit? For your pit, actually those pits are quite easy to see in an oral cavity, an actual patient, because sometimes or most of the time, not sometimes, you can see a dark dot there, meaning there's a imperfection or a pit that can be easiest portal of entry for your dental caries. So, by definition, a pit is a pinpoint depression in enamel which may be a true or a fault. When we say a true pit, it is created due to the bisection or branching termination of developmental groove, which are found occlusally in the bottom of your singular or circular and or triangular fossa. For this case, we have your circular fossa. But for first molars, first example a while ago, you have your triangular fossae here. You have your triangular fossae here. So here, you can see, wait, I'll use my pen. You can see here pit and pit here, distal pit and mesial pit. So that's a true pit. How about the false pit? So fault pit, no, I'm sorry. A fault pit naman is created due to tiny, localized, imperfect fusion of your or defective formation of enamel found in the buccal and lingual terminations of your developmental grooves. So usually, pag nagpapasta, unang-una nyo makikita yan. How about your developmental lobes? Yeah, this area, mas kita siya. Developmental lobes. Each tooth begins to develop from 4 or more growth centers or developmental lobes. Anterior teeth and maxillary premolars develop from 4 lobes. We can see 3 from the labial aspect and 1 from the lingual. As the lobes grow, they coalesce. These lines forms the fusion that are called developmental grooves. So the mamelons naman are incisal ridges of the 3 labial developmental lobes of the anterior teeth. So you'll see like this. If freshly erupted pa siya, you'll see those 3 wavy appearance. The lingual lobe makes up the cingulum of your tooth. So yeah, I have 1, 2, 3 lobes. And where is the 4th? It can be found on your lingual. The 4th lobe is your cingulum. The lobes and the cusp. For maxillary premolars, you have 3 facial lobes and 1 lingual lobe. So you have 3 facial, 1, 2, and 3, which gives us a high buccal cusp. While for the lingual, you have this 4th lobe, which is a large lingual cusp. The buccal cusp and single lingual cusp. For mandibular first premolar, it has the same concept except that it has a smaller lingual cusp compared to your maxillary. But for your mandibular second premolar, it is a different story. Again, I'll have to show you first the mandibular first. So for your mandibular first premolar, you have 3 lobes. I'm sorry. 1, 2, 3. And a smaller 4th lobe or 4th lingual cusp. For your second premolar naman, there is a variety. You have your 2 cusp variety, which is same as your first premolar, but we have here a 3 cusp variety, which has 3 lobes that can be found here. You have 1, 2, 3. And as you can see on the lingual aspect, you have 2 cusp there. So you have 2 lingual lobes leading into 2 lingual cusp. You have your mesiolingual cusp of your second mandibular second premolar and the distolingual cusp, which is quite different from the first premolar of your lower arch. How about the four lobes of your maxillary second premolar? For your maxillary second premolar, you have your first lobe here, second lobe here, a third lobe here, and a fourth lingual lobe. That is exclusively for your maxillary second premolar. For your lobes and cusps, for your molars, first, starting with your maxillary first molars, you have two major facial lobes, which are the mesiobuccal and the distobuccal. So here is your mesiobuccal, and you have your distobuccal. You have one major lingual lobe, which is your mesiolingual lobe. Major meaning malaki din. One minor lobe in the lingual area, which is your DL or the distal lingual. I'm sorry. And lastly, a one rudimentary or extra or accessory, one rudimentary lobe, which is called as the carabelly. Okay, where is it? I cannot see it, Doc. So here it is. It is one of the distinct characteristic of your maxillary first molar. For your second molar, almost the same, but it doesn't have an accessory cusp. You have four lobes, but it doesn't have the cusp of carabelli. It has your first, second, third, and fourth, but absent si cusp of carabelli. Wala. For your third molars, usually 3 to 4 lobes. So, as you can see here, this is a 4 lobe. 1, 2, 3, 4. So, usually, when I was a student, I associate lobes as my future cusp. So, I just imagine how many cusps do I have for that specific tooth, and somehow, for my posteriors, it will predict how many lobes do I have. How about for your lower? For your lower molars, how many cusps do we have? So, for your lower first molar, this is quite a different story because of the presence of your distal cusp. If your maxillary first molar has the carabelli cusp or the cusp of carabelli, the mandibular first molar has its distal cusp. Wrong spelling. The distal cusp. So, for the first molar, you have 4 major cusps. 4 major cusps. You have 1 minor cusp. Any idea which cusp is that? Of course, the minor cusp is your distal cusp. So you have 5 lobes for your mandibular first molar. For your mandibular second molar, you have 4 lobes and cusp. By second, 1, 2, 3, and 4. But for your third molar, this is quite unpredictable for it. The anatomical characteristic of your mandibular third molar varies. It can vary from 3 lobes, 4 lobes, or even 5 lobes.